Our blood, a vital life force, courses through our veins, carrying oxygen and nutrients to every cell. But what happens when the very essence of life turns against us? This is the stark reality of blood cancers, affecting the production and function of blood cells. Blood cancers like leukemia and thalassemia are silent adversaries, manifesting with debilitating symptoms. They can strike anyone, turning lives upside down. Understanding these diseases is the first step towards prevention and a healthier future. Leukemia, a word derived from the Greek words for whitened blood, is a cancer of the blood and bone marrow. It arises from an overproduction of abnormal white blood cells called leukemic cells, which crowd out healthy blood cells. White blood cells are our immune system's warriors, fighting infections and protecting us from harm. In leukemia, these warrior cells become corrupted, multiplying uncontrollably and losing their ability to function properly. Imagine an army of soldiers, once disciplined and effective, turning rogue and attacking their own city. This is akin to what happens in leukemia as the body becomes its own enemy. There are several types of leukemia, broadly classified by the type of white blood cell affected and the speed of disease progression. Acute leukemia progresses rapidly, while chronic leukemia develops more slowly. The most common types include acute myeloid leukemia, AML, acute lymphocytic leukemia, AL, chronic myeloid leukemia, CML, and chronic lymphocytic leukemia, CLL. Thalassemia, unlike leukemia, is not a cancer, but an inherited blood disorder. It affects the body's ability to produce hemoglobin, a protein in red blood cells that carries oxygen throughout the body. This deficiency in hemoglobin disrupts the oxygen-carrying capacity of the blood, leading to a range of health problems. Imagine a fleet of ships responsible for transporting essential goods across the ocean. In thalassemia, these ships are like red blood cells, and the goods they carry are oxygen molecules. Due to a genetic defect, the ships are not built properly, reducing their capacity to carry oxygen effectively. There are two main types of thalassemia: alpha thalassemia and beta thalassemia. These names refer to the two protein chains that make up hemoglobin. Alpha thalassemia affects the production of the alpha globin chain, while beta thalassemia affects the beta globin chain. The severity of thalassemia depends on how many of these chains are affected. Thalassemia minor occurs when an individual inherits one normal gene and one thalassemia gene. People with thalassemia minor often have no symptoms. Thalassemia major is a more severe form. It occurs when an individual inherits two thalassemia genes. People with thalassemia major require regular blood transfusions. Leukemia can affect anyone, regardless of age, ethnicity, or gender. Certain factors like radiation, chemicals, and chemotherapy increase the risk. Thalassemia is an inherited blood disorder, common in Mediterranean, African, and Southeast Asian people. Understanding these helps in early detection and genetic counseling. The prevention of blood cancers is complex due to multifaceted causes. While we can't eliminate the risk, steps like avoiding radiation and carcinogens, maintaining a healthy lifestyle, and genetic counseling can help. Avoiding radiation and carcinogens is crucial. Carrier screening and genetic counseling are key for thalassemia prevention. Early detection plays a vital role in improving outcomes for both leukemia and thalassemia. Recognizing the early signs and symptoms of these diseases can lead to timely diagnosis and prompt treatment. It is essential to be aware of these signs and seek medical attention if you experience any unusual symptoms. Common symptoms of leukemia include fatigue, weakness, pale skin, shortness of breath, frequent infections, easy bruising or bleeding, bone pain, and swollen lymph nodes. If you experience any of these symptoms persistently, it is crucial to consult a healthcare professional for a proper diagnosis. For thalassemia, early detection is particularly important for infants and young children. Newborn screening programs in many countries test for thalassemia at birth. Early diagnosis allows for timely intervention with regular blood transfusions and chelation therapy, which helps remove excess iron from the body. Living with a blood cancer like leukemia or thalassemia can be challenging, requiring significant adjustments to one's life. The diagnosis can be overwhelming and the journey through treatment can be arduous. However, with the right medical care and support, individuals with these diseases can lead fulfilling lives. Treatment for leukemia typically involves chemotherapy or radiation therapy. Managing thalassemia involves lifelong blood transfusions to maintain hemoglobin levels. The field of blood cancer treatment is constantly evolving, with promising advancements on the horizon. Researchers are working tirelessly to develop new therapies that are more effective, less toxic, and tailored to each patient's unique genetic makeup. Targeted therapies, for instance, are a new class of drugs that specifically target cancer cells while sparing healthy cells. These therapies work by blocking specific proteins or pathways that are essential for cancer cell growth and survival. Immunotherapy, another exciting area of research, harnesses the body's own immune system to fight cancer cells. Gene therapy, while still in its early stages, holds immense potential for treating blood cancers like thalassemia. This approach aims to correct the underlying genetic defect that causes the disease. By replacing the faulty gene with a healthy copy, gene therapy has the potential to provide a cure for thalassemia. Blood cancers, while daunting, are not insurmountable challenges. By arming ourselves with knowledge, we can take proactive steps to protect our health and the health of our loved ones. Understanding the risk factors, recognizing early symptoms, and seeking timely medical attention can make a world of difference. Empower yourself with information. Learn about blood cancers, their causes, symptoms, and treatment options. Spread awareness in your community and support organizations dedicated to research and patient care. Together, we can make a difference in the fight against blood cancers. Remember, knowledge is power. By understanding these diseases, we can break down the stigma surrounding them, encourage early detection, and support the development of new and innovative treatments. Let us work together to create a future where blood cancers no longer pose a threat to human health.